Welcome to Nursing School Explained, and this video on pediatric pain relief and the medication acetaminophen or Tylenol. So this is a medication that you'll see very frequently given in the clinical setting, in the inpatient, outpatient setting, and this is something that parents will give at home to their child as well in case they are sick with what's going around right now in the winter season, cough and cold viruses. So here, first of all, acetaminophen, the class, is an analgesic or antipyretic. So the indications we use it for are mild pain as well as fever. It's available in the following routes: PO, PR, and IV. And the dosage in pediatrics, many times, especially for pain medications, they have a range. So 10 to 15 milligrams per kilogram per dose every 4 to 6 hours, except when we're dealing with neonates. Then we give it every 6 to 8 hours because neonates, their digestive system, their liver, the methods that they're going to excrete with is a little bit slower and more immature. So we want to space it out just a little bit more for safety here. And as always with pediatric medications, there is going to be a maximum dose. And in this case for Tylenol, the maximum dose is 90 milligrams per kilo per day, which is a 24-hour period. So make sure that you check that to not exceed that. Which brings me to the next point. NTE stands for not to exceed 5 doses per 24 hours. So theoretically, if we give the medication every 4 to 6 hours, we could give the patient a total of 6 doses. If we gave it every 4 hours, we could fit in 6 doses, but we really want to only give 5 doses for that 24-hour period. And then another part that's really important to know is that it comes in different strengths in availability. So there's infant Tylenol that's a little bit more concentrated, where we have 80 milligrams per 0.8 milliliters, which is a very small amount, but pretty concentrated. And then children's Tylenol, which is 160 milligrams per 5 milliliters or teaspoon, as we usually give it for pediatrics. And note that this is in milliliters because in pediatrics we always give the PO doses in liquid form. It's easy for them to swallow. And for the availability, another note, make sure that you check the bottle that this medication comes from to see which one it is, or maybe there's a different strength that's available in your specific area or in your clinical setting. Thanks for watching. Please also check out the other video where I go over a dosage calculation example that includes the dosage per dose per administration, but also where I go into the maximum dose calculation based on the patient's weight. So check those videos out as well, and I'll see you soon right here on Nursing School Explained.